Hello, and welcome to our student discussion on what is healthcare. At Case Western Reserve University, we define healthcare as working and learning together to help all people live well. Healthcare includes addressing all aspects of life that affect health and wellness, from food and shelter to lifestyle choices and pollution. It includes learning with curiosity, serving others, individuals, and whole communities, advancing science with discoveries that make a difference, and healing whatever brokenness we find. At Case Western Reserve University, we blend these efforts to move healthcare forward into the promise of what it can be, right here in Cleveland. We must acknowledge that 2020 has been filled with challenges. The global pandemic caused by the SARS coronavirus 2 has wreaked havoc within many communities and altered our daily living for 9 months now. And the national conversation about systemic racism has elevated this problem to be a public health crisis. In combination, these events have shed light on some of the important gaps and disparities that exist in healthcare, but they have also elevated the healthcare providers to everyday heroes, quietly doing their work to meet the needs of the people in front of them. We are proud to be future healers, and we share 4 student discussions with you that highlight our definition of healthcare. Learning. At the beginning of the healthcare journey, we are seeds packed with potential, and we must land on fertile soil to grow into all that we will become. Case Western Reserve University School of Medicine is a rich environment that feeds and nourishes us. Let me turn it over to Dr. Amy Wilson-Delfas to facilitate this discussion.
Thanks, Leah. Welcome to our discussion with students from the MD, the Medical Scientist Training, and Physician Assistant programs at Case Western Reserve University School of Medicine. Students, please tell us your name and in one word or a very short phrase, how you would describe your learning experience in the School of Medicine. Trey?
Hi, my name is Edward Barksdale. I'm a third-year medical student at Case, and my word would be inspiration.
Great. Kevin?
Hi, my name is Kevin Allen, and I'm in my last year of the PhD in the MD PhD program. And I would describe the curriculum as encouraging the development of lifelong learning.
Terrific. Catherine?
Hi, my name is Catherine Feng. I'm a second-year physician assistant student. The one word I will use to describe my learning experience at the School of Medicine would be innovative.
Nice. Dustin?
Hi, my name is Dustin DeMeo. I'm a third-year medical student, and one word, transformative.
All right. Okay. What do you value most about being a learner in the MD, the MD PhD, and the physician assistant programs?
For me, I would most say is the opportunity to not only follow my passion for becoming a doctor, but also the many avenues I've been able to access and utilize at Case. And one of those really would be the health innovation and entrepreneurship pathway. I've been able to both test out ideas, learn about changes in medicine, both from a medical standpoint and also innovation, entrepreneurship standpoint, and hopefully grow as I go forward to utilize those in my practice and also benefiting the communities I work in.
Really nice. Kevin, how about you?
So Case has really equipped us to approach lifelong learning with both curiosity and rigor by providing a multitude of opportunities to learn and experience clinical medicine and translational research. Specifically, we perform cutting-edge research in top labs in the world and simultaneously work with talented clinicians that match our field of interest. And so together, this allows us to enter the clinic, identify current limitations, develop testable questions to pursue, and then bring back solutions to the clinic. And through this process, we witness the potential synergy of working at both the bench and bedside to propel medicine forward.
Thanks, Kevin. Catherine?
So I think students at Case Western have many opportunities to learn together and work together interprofessionally. One example is the Interprofessional Scholars Collaboration in Teaching and Learning program, which brings together medical students, physician assistant students, and faculty to work in student-faculty pairs to develop and implement innovative curricula. There's also the Interprofessional Learning Exchange and Practice Program, which recruits students from medicine, dental, nursing, physician assistant, social work, and the nutrition program to work in interprofessional teams to improve gaps in care in either a clinical or a community setting. The student-run health clinic run entirely by Case Western students is another example where health professions and social science students learn from each other and collaborate to deliver high quality and compassionate care to clients in our community. To me, what is so valuable here is the opportunity for students to work as a team, to ask questions, to be supportive of other professions' roles in healthcare, and cultivate those collaborative skills. At Case, we're always looking for innovative ways for students to engage in interprofessional education and collaboration.
Great. Dustin, how about you?
Well, my work was transformational. And when I first came to Case, I came because I wanted to transform lives. I think what I wasn't counting on was how much it would transform me and continues to do so. One big way is just becoming a better listener rather than just hearing. People come from so many different backgrounds, my peers, our patients, our faculty, and learning how to communicate and avoid miscommunication has been, a big growth learning edge for me. And the way Case, I think, really delivers on that is through asking us to reflect and giving us a lot of non-judgmental feedback, and developing a culture where we just try to get better every day. And I love the culture. Also, it's, I guess, what you might call a high-touch environment where we get a lot of one-on-one opportunities. For example, working with Dr. Robert Jones in the ultrasound elective, there were 12 of us students working with the busy emergency room attending, who also runs a clerkship. And he would come in and work with us and not just show us how to use the ultrasound, not just how to make diagnoses on the screen, but how to make patients feel comfortable. And it's just amazing to work with people like that. Also, we have a whole section called Foundations of Medicine, what the students like to call Touchy-Feely Tuesday. And it's where we get a chance in small groups to sit down and talk about some of the more humanistic or, hard to touch with our textbooks parts of medicine. Imagine sitting down to a lecture in the morning about a rare disease, and then in the afternoon in a small group, being able to meet with a patient or a family and understand that disease is not just diagnoses, but it's an experience for somebody else. And I'll tell you what, going through that, we will never forget what we learn in the textbooks. You just don't want to miss anything, and you connect with the patients. So very transformational, and I look forward to bringing it to the world.
Terrific. As you know, the medical school at Case Western Reserve University has a very long history of students and faculty working together as colleagues in teaching and learning and research. The nature of our curriculum also encourages students collaborating with other students. So now, please tell us about your experience collaborating with peers and faculty. Trey?
I think this ties directly to my first word, and that's inspiration or inspiring. And you can kind of see it with all what we were talking about. For me, it's been the opportunity to be part of a program that has challenged me to travel outside the confines of the standard learning, while also establishing a platform to really pursue my passions and learn from the people I'm around. Case Western has provided a unique opportunity to not only grow, work, and learn, but also do it with a unique group of people who are all focused on attaining the same goal, but have different perspectives, outlooks on lives, and backgrounds. And that diversity has been truly inspiring and in many ways empowering. And going forward, not only do I look to carry this forward, but I also look to learn from the people I interact with very similarly. And so hopefully this will continually work throughout my life and while I'm a doctor.
That's really inspiring, Trey. Thank you. Kevin.
So I think, everyone's been saying this, but really learning how to communicate and collaborate with researchers, patients, and patient families is a complete necessity. And really from the beginning, medical students at Case primarily learn by working in small groups of diverse students to tackle clinical cases. So not only do we increase our medical knowledge, but we actually also learn how to effectively communicate and actively listen to each other. Additionally, there are multiple avenues to allow students to work alongside medical school faculty to shape and improve the curriculum based off student feedback. And this type of collaboration and communication is what's going to inspire our future patients and future colleagues to work with us to ultimately improve healthcare.
Thank you, Kevin. Catherine.
So I'm a part of the Interprofessional Scholars Collaboration in Teaching and Learning Program, also known as iSkittle. I'm currently collaborating with the physician faculty to develop an educational curriculum aimed at bringing simulations to health profession students early in their careers. Over the last 7 months, we witnessed a transformation of budding ideas into implementable curriculum projects. My faculty mentor and I meet weekly to work on a project. It seemed at every meeting we would pull inspiration from somewhere, make adjustments, and we always kept an open mind throughout the whole process. And looking back, it was quite remarkable how an idea became a concrete, deliverable curriculum for students at Case Western. This was a really incredible and rewarding experience, learning with and working with my peers in the School of Medicine, with their faculty mentors, and with our partner scholars in a medical school at Albert Einstein Israelite Hospital in Brazil. And this program not only helped me develop and enhance my skills in medical education and research, it also expanded my horizon on academic and career interests. The iSkittle program reframed the way I view student-faculty collaborations in educational development. It really showed me that student input is strongly encouraged and truly valued.
Catherine, thank you for sharing that collaboration. Dustin.
I mean, I think collaboration is Case DNA. It's at the bedrock of what we do. It's our culture. And apart from the small groups that you've heard about, apart from the clinical experiences that are part of medical school, there are a lot of really surprising ways in which we get to collaborate and which really are fantastic opportunities. So I worked with the student-run health clinic, and there it's an interprofessional environment where we work on teams with actual patients. And I think one of the most amazing experiences I had was working with a patient with my social work colleague. And there we asked, and I learned from my social work colleague about how to ask the patient the hard questions, what's affecting their life, how to meet them where they are, their needs, their support, their barriers. And working in a team like that really made me feel that, yes, I am part of a team and that is my role. And it was a fantastic, and it is a fantastic experience for everyone who does it. Another fantastic thing was when the COVID pandemic hit, students were locked out of research labs. And so the curricula, staff, and leadership booted an entire remote research curricula within a matter of a couple weeks. It was remarkable. I got to be part of that team. And I'll tell you, they reached out across institutions, across all the departments at Case. They interfaced with students to make sure it would work with them. They made sure it would work for our requirements for graduating medical school. And personally, you know, we'd have meetings and I'd be able to call my faculty members late into the night. That's just part of what it is. I mean, I think every faculty member probably on campus would know our names. It's fantastic. The deans know our names and our professors know our names. So yes, collaboration is at the heart of everything we do.
Trey, Kevin, Catherine, Dustin, thank you so much for participating today. It is truly a joy for all of your faculty to collaborate with you. Thank you.
Discovery. Science is real and guides our curiosity to ask the hard why questions, and then to systematically seek answers and discover new knowledge to deepen our understanding of disease, treatment, and how to promote health. Derek Abbott will discuss this with some of our students doing a broad range of science and discoveries.
I'm Derek Abbott, the director of Case Western's MD-PhD program. In this program, students complete both a medical doctorate and a doctorate of philosophy. We're the oldest combined MD-PhD program in the country and we've been training physician scientists for over 60 years. Our training spans the translational spectrum, from Otis Pinkert, who's doing foundational science, to Dan Leonard, whose focuses on drug discovery, to Morgan McGrath, who's merging engineering, patient care, and clinical research, to Uriel Kim, who studies population health and health disparities. So Otis, you're on the earliest part of this translational spectrum. Can you tell us why your foundational work is important and how it relates to future medical care?
Of course, Derek. Thank you very much for the introduction. As you stated, my work occurs very early on in the translational spectrum. At this stage, we're looking to discover and explore new fundamental processes by which life has evolved to thrive on Earth. Many of the evolutionary innovations we as humans use to function in society were adapted from our evolutionary relatives. These relatives include the baker's yeast, which allows our breads to rise, all across evolutionary time to the chimpanzees with which we share 99.9% of our genetic material. Much of the discovery at this early stage in the clinical spectrum or translational spectrum begins with studies looking at these close evolutionary relatives. We look to see what processes they use to adapt to changes in their environment, to grow in size, and to multiply, creating new offspring. In particular, we're interested in finding if these processes are broken in different human diseases, or if we could use these processes in some way to benefit patients as a new therapeutic treatment in the clinic. As an example of this early stage of clinical discovery, my work over the past few years focuses on how individual cells in our bodies use the information we inherit from our parents as DNA to become a muscle cell to keep our hearts beating, a skin cell to help protect us from the environment around us, or even a nerve cell in our brain, allowing us to think about our complex and fascinating world. Specifically, I study how these interactions programmed in our DNA are translated into the functional building blocks needed for us to live our everyday lives. This process is not unique to humans. In fact, without exception, this process of translation is essential to the success of all known forms of carbon-based life here on Earth. Recent technological advances achieved through work performed by some wonderful colleagues and myself at Case Western Reserve University School of Medicine added to the recently increasing amount of evidence suggesting this fundamental process of translation is broken in a wide range of human diseases. So for my work, the next stage of the discovery process is to assess which part or parts of translation we can target to create new therapeutic options to treat or monitor human disease. Our colleague Dan is someone who has experience navigating this type of work. Dan, would you be willing to share with us more about your type of research and how it is integral to the discovery process, and tell us a little bit more about your recent remarkable findings?
Sure, yeah, of course, Otis. So as Otis explained, understanding the fundamental mechanisms and processes that sustain life is really the foundation for the development of potential therapies. Once we understand the intricacies of a particular biological process, we can then take advantage of this knowledge to help patients by developing markers of disease, markers that can predict outcomes, or as in my case, targeted therapies. So my work is focused mainly on refining a new drug class that actually helps to enhance the activity of a protein in the cell. And it usually works to maintain a type of checks and balances. And in human disease, the protein is essentially turned off. So we've been able to identify a group of potential drugs that bind to this protein family and enhance particular disease-fighting functions. And so now I've been working to maximize its ability to kill cancer cells while preventing or at least limiting any potential toxicities that are associated with the therapy. And so this is where preclinical treatment studies or treatment in animals is used to help guide which patients might get the therapy first in the clinic. From there, we're able to carry out clinical studies where safety and efficacy are tested in actual human patients. And so this is an area where Morgan's been working a little bit closer. And so I'll send it over to her and she can elaborate further on these and other types of clinical studies.
Thank you, Dan. So as Dan mentioned, my work looks very different from the science that he and Otis are doing. I work in clinical research where I have the privilege of working directly with patients to develop new kinds of clinical assessments and therapies that will help physicians provide truly personalized medical care. Right now at Case Western School of Medicine, I'm working with the latest in virtual reality technology that was actually originally developed for video gaming. The goal of my work is to use this technology to help healthcare providers understand the unique needs of each individual patient and inform specific treatment strategies. We're using a virtual reality headset and a multi-directional treadmill to develop an immersive experience for patients. Using this technology, we're able to recreate realistic virtual worlds that can be used to assess patients' abilities to perform the kinds of functional tasks that they rely on in their everyday lives, like shopping at a grocery store or going to the bank. Virtual experiences like these are a safe and standardized way to assess what difficulties patients may be having at home, also to evaluate how well medications may be working, and to direct specific goals for physical therapy. Our current project works with patients with Parkinson's disease, but this technology can be used in a wide variety of patient populations. Virtual reality assessments can also be used by the Department of Defense in a military environment to evaluate and treat traumatic brain injuries in an effort to maintain troop readiness. In this way, clinical research with human subjects can develop new clinical tools to improve health outcomes for patients from all different backgrounds with a wide range of illnesses. Clinical research relies on the foundational discoveries like those uncovered in Otis's and Dan's research. We have to understand the underlying processes of health and disease before we can try to assess and treat individual patients. The next step is to understand how these advancements in clinical care can actually translate to improving the health of entire populations. And this is where Uriel's work comes in.
That's absolutely correct, Morgan. So my work focuses at the population level. So it's really about understanding how the discoveries we've made in cells and petri dishes and laboratory settings like Otis's research, or the incredible new drugs that we're developing like Dan's research, or the innovations we're making in clinical practice like Morgan's research. My research is really trying to understand how we bring to bear those innovations on communities and populations to move the needle on health. So my research specifically focuses on evaluating specific policies and interventions that aim to improve access to healthcare, especially in medically vulnerable populations or populations with low income. So we found that individuals with low income, the uninsured rate has dramatically decreased following the implementation of insurance reforms like Medicaid expansion and marketplace insurance. Also, we found that among individuals who've recently gained insurance coverage through Medicaid expansion or the marketplace, those individuals report having greater access to healthcare, fewer issues with medical bills, and fewer issues with healthcare unaffordability. Most importantly, what we've been able to document is that individuals who gain insurance coverage have the benefit of having really substantial improvements in health outcomes. So for example, among low-income cancer patients, those who recently gained coverage through Medicaid expansion are 15% less likely to be diagnosed with the most deadly forms of breast, cervical, lung, and colorectal cancer. So what this means is that innovations in healthcare delivery and reform have saved thousands of lives.
Great, thank you everyone. So as you can see, the Case Western MD PhD program runs the gamut from foundational science to population health. So I have a question for the four of you. Based on your experiences, what changes or new advances are you most excited about? And what do you see as the biggest hurdle for that advancement?
That's a great question, Derek. I think I'll get us started. The more we study our genetic code, and how it determines our physical properties, the more we realize its regulation of expression occurs in smaller and smaller increments. We have known for many decades that the tissues of our bodies are composed of individual cells who must work together in concert to orchestrate the tissue's normal functions. Within the past 10 years, though, the first papers describing these proposed differences between individual cells were published. These papers have revealed that a single type of cell may be the driving force for many of the debilitating diseases, including cystic fibrosis and heritable forms of diabetes. I'm excited to see how new ways of regulating our inherited genes at the level of individual cells may finally answer some long-lasting questions in the clinic, leading to new therapeutic or even curative options for otherwise untreatable diseases and disorders. However, there are some significant hurdles preventing the application of these new and exciting findings to individual cells. Currently, many of the fundamental processes discovered at the foundational research level of the translational spectrum cannot be assessed in individual cells due to technological or financial limitations. Many of the required technologies are not developed, or experiments are simply not attempted at academic institutions due to their prohibitive cost and lack of available resources. Navigating this hurdle will require a significant reduction in the cost of sequencing of our genome, and will require continued long-term investment in academic institutions and laboratories to develop and apply new approaches to understanding human disease.
Thanks, Otis. I mean, I couldn't agree with you more. I think some of what I have to say also echoes this. So in terms of the arena of drug development, I think that the biggest hurdle is this major logistical gap that exists between the findings that people like Otis and myself make in fundamental sciences and how we execute the transition of those drugs into the clinic. And currently, this gap is mainly filled by pharmaceutical companies who absorb the inherent financial risk that's associated with this execution of drugs into the clinic. And in return, they typically have the potential reward of commercialization of any potential new therapies. And that's the side that's often demonized by society. And in the end, unfortunately, the taxpayer ends up footing the bill twice, right? Once for the original scientific discovery, and then a second time when they actually need the therapy. What I'm excited about is, fortunately, some pharmaceutical companies and other private sector companies have already begun reaching across the aisle, if you will, to invite some of these academic labs into the drug development process early at the ground floor. And so some hybrid programs allow scientists to continue to explore fundamental science, but the private sector essentially foots some of the bill, which relieves some of the burden from NIH. The remaining piece of the puzzle that's still missing for us as a society is to recognize that the upfront costs associated with increasing our investment in drug development through NIH will actually allow NIH to own these new molecules, and thus they belong to the people and actually help save us money in the long run. So I think this gets back to the idea that do no harm is really a vow that we take as physicians that not only reflects our medical intent, but also our social intent, right? And so we want to eliminate all types of burden in order to improve overall health. And unfortunately, our current approach to drug development and healthcare in general makes cost one of these major burdens for many patients.
Dan, I couldn't agree more. I think your points about access to new therapies are spot on and really tie in well to what I'd like to talk about for this question. Because what really gets me excited about the future of my realm of research is this push towards personalized medical care. So rather than treating a diagnosis or a disease, it's really important that healthcare providers treat the entire patient. Personalized medicine requires that physicians have the proper tools for clinical assessment so that they can get that full picture of the struggles, the triumphs, and the goals of each patient. And it's only with that kind of understanding that we can begin to design individual treatment strategies involving everything from medications, like we've discussed, also to physical therapy and specific changes in diet and exercise. But I see two main hurdles to this goal. One is to make sure that physicians have enough time with each patient to develop the depth of relationship that they really need to provide optimal treatment. And this is difficult as appointment times get shorter and the time required for insurance documentation keeps going up. And the second hurdle I see here is ensuring that all clinical locations, regardless of size or their financial resources, have equal access to these new assessment and treatment tools, especially as these tools make more use of the latest advancements in technology. So being mindful of price tags and access will continue to be imperative to reduce health disparities. And I know that's something that Uriel has focused on in his work as well.
That was such a good answer, Morgan. I'm not sure if I can speak to this question as eloquently as you did, But I will say this, I really love doing my research and being a student here at Case because it's always been my dream to be a scientist and a physician. And I know that I'm able to chase this dream because I have the benefit of my health. And that's what really excites me and what really drives my research. The ability to pursue one's passions and dreams is really predicated on having the benefit of good health. So the ultimate goal of my research is really to understand the best policies and interventions that will ensure that all Americans have equitable and affordable access to life-saving, life-changing healthcare. And by doing so, I really hope that we can play a role in ensuring that we can all live our lives to the fullest.
Thank you, everybody. So you see, discovery is a continuum. It's a long process and there's a lot of work to do. But at Case Western and other medical schools throughout the country, we're training future physician scientist leaders to advance the next century of medicine.
Service to others. Healthcare is service to others, meeting the needs where our individual patients and their communities need us most. The medical appointment is such a small piece of health and wellness. Everyday choices about food, exercise, and safe living have much greater impact on living a long, healthy life. Working on these basics in collaboration with our patients is what helps us as future healers better address the needs, especially those most in need. We have Cindy Lord and Dr. Prabha Rajendram exploring this more with our students.
Hello, and welcome to our session, Service to Others. My name is Cindy Lord, and I'm the director of the Physician Assistant Program here at Case Western Reserve University School of Medicine. I'll be facilitating this session with my colleague, Dr. Prabhalini Rajendram. Prabha?
Cindy, for the introduction. I'm Prabha Rajendram. I am an intensivist at Cleveland Clinic in the Respiratory Institute. I also serve at Cleveland Clinic Leno College of Medicine as a lead for interprofessional education. I'm also the faculty lead for the Fresh Fairfax project.
That's awesome. So we are happy today to be joined by our students, Morgan, Scott, and Carolyn, who will share their experiences providing service to others. Morgan, let's start with you. If you could please introduce yourself, and if you could, please share with us any personal strengths that you discovered as a result of your community work at Case.
Hello, my name is Morgan Green. I'm a recent graduate from the Physician Assistant Program at Case Western Reserve University. For me, being in the community was inspiring. There's so much need here, and there's so much that we can do out in the community to help others. And the more that I did out in the community, the more that I wanted to get involved in other ways and help more people.
Thank you, Morgan. Scott, can you please tell us a little bit about yourself and any personal strengths that you've discovered as a result of your community work here at Case?
Thank you. My name is Scott Angewerden. I am a medical student in my final year at the Cleveland Clinic Lerner College of Medicine within Case Western Reserve University. Through my time participating in community work at the school, I really developed a strength and passion for teamwork. And I think that goes both in forming collaborations and teamworks with local community members and with my peers and reaching across different health professions. I found that, working as a group, you have a great sense of camaraderie and you're able to accomplish much more than I could on my own. I just find it very fulfilling.
Thank you for that thoughtful response. Carolyn, if you could please introduce yourself, and if you would share with us how you were able to create relationships in the community that were transformative, not transactional.
Sure. I'm Caroline Sugar. I'm a PhD student in molecular medicine at Case Western and at the Cleveland Clinic studying cancer. I'm also the president of the Case Western Science and Human Rights Coalition. And in my work with our group, we learned that we have to do more than just meet an end goal. To create sustainable and lasting impact on our communities, the full community has to work together to determine the needs and best practices to benefit everyone involved.
Awesome.
Thank you, Carolyn. That was great. So I wanted to just say a few words about what service to others means. It has us focusing on striving to meet the patients where they are. It helps us to broaden our definition of healthcare to include social determinants of health like food insecurity, community, safety, and the environment. Scott, you, Morgan, and some other students were involved in the development of the Fresh Fairfax project, which is a collaboration between Case Western Reserve University and Cleveland Clinic. Would you provide us with a brief overview of Fairfax Fresh project?
I would love to. So the Fairfax Fresh Project was an opportunity for students at Case Western Reserve University and the Cleveland Clinic to reach out beyond the walls of the school and to get to know the community and work with them to address some of their needs, provide some services outside kind of our academic center. I mean, this is a neighborhood within walking distance of world-class health institutions, yet at the same time, the residents there face significant barriers to healthcare. So we wanted this project to be an opportunity to use our newly acquired skills as students in healthcare, all the knowledge that we had gained, to address and meet some of these needs of our local community. The great thing about how we decided to do it was that we wanted it to be entirely student-led. So we designed this program to include students from all health professions to utilize strengths of every school. So we had the medical school, the physician assistant program, social work students, public health students, the nursing school, everyone was involved, everyone had a seat at the table. We sat down and we talked, and after some initial training about leadership skills and how to work effectively as a team, we started to reach out to the community. We invited members of the community to come talk to us about different challenges that they face. We went out into the community, we met with them, and really just tried to interview and get a sense of what was going on, what life was like for them. At that point, we identified several different areas that as students, we might be able to provide some assistance. Ultimately, we narrowed it down to one, and we decided that one way that we could help was that after regular working hours, we would offer a sort of clinic where residents could come in, get health screenings and counseling about the different challenges they face, whether that be food insecurity, health systems access, and ways that we could provide different resources to them. And so by meeting them in the community and providing it after hours when normally the services they accessed weren't available, we were able to have some additional value for them and really meet a need while learning as students how to work with members of the community.
Thank you.
So Morgan, authentic community engagement is defined as consistent and persistent engagement with an entire community for the purpose of establishing a foundation of partnership, trust, and empowerment. Talk to us about the relationships that you developed with your community partners as part of the Fairfax Fresh project.
Yes, absolutely. So similar to what Scott was just talking about, this project was so unique in the fact that we were able to meet with the community before we even have a project in mind. We sat down with them, got to know what they thought their strengths and weaknesses of their community were and the challenges that they face every day. And then they came up with ideas how we could fit into that and how we could help and extend our services. And that was a really cool aspect in the fact that we got to really know them and see their community and learn from them. The other thing that Scott talked about was that counseling aspect of the project where students were able to sit one-on-one with the resident and talk to them about their life, their struggles, their strengths, and really develop a relationship. That part of the program was designed with the idea in mind that students can learn just as much, if not more, from the residents of the Fairfax community as those residents learned from us as students.
Thank you, Morgan.
Scott, how did you establish the legitimacy and trust within the community? And how did you also cultivate community buy-in?
Yeah, so this I think is one of the greatest challenges to doing a project like this. And because it was so key, I think we've touched on it already a couple of times, we really wanted members of the community to trust us, and the way we felt we could do that was to involve them from day one. Before we even knew what we would be doing in the community, we had community leaders coming to our meetings and talking with us about what they needed. Ultimately, it didn't require some grand innovation from us about some service that no one had ever thought of. It was just listening to what they needed and really getting a sense for the fix that they already knew that they wanted. Interestingly, one of the first things they told us when we came was, if you guys are going to be here for 6 months, don't bother. They gave us this real clear sense of, we have plenty of people who stop by, do their thing, and then leave. What we want is someone who will be a lasting partner for the community. So we made it very clear we're going to be deliberate, we're going to be slow, and this is going to be something that's going to be lasting. We're planning to be here for years. This isn't going anywhere. And when we got that message across, I think they kind of let their guard down and really were willing to share with us the things that they needed and how we could be not just showing up to do some clinic or service, but be members of the community.
Thank you, Scott, for that very detailed explanation. Morgan, describe how you've developed, through service to others, a better understanding of your limited perspective into others' lives. Are you only catching a glimpse of a patient's life when they're in the clinic, while service helps you understand other struggles that they may actually have?
Yes, absolutely. I believe that seeing a patient in the clinic is not always a true representation of that patient's life and the struggles that they face every day. They come in to us with a specific problem, but that problem might be compiled by a lot of different aspects of their life and of their environment. And so this project took us into the community that they live in every single day and gives us a window into their everyday life, which is something very different than we see in a clinic or hospital setting. Then when you sit down and actually discuss with the patients about their struggles and really get to know them beyond their medical complaint, you really get to know and understand, or try to understand, their social determinants of health. And I think that's what we got in this project, which is really fascinating.
Thank you, Morgan, for your wonderful insight.
Carolyn, your service to others has come in the form of advocacy. You are a passionate advocate of science as a course of study in school and becoming a scientist as a career choice. Please tell us more about your work in the community.
Sure. I really love science, and it makes me so happy to see when young people discover their love of science. The last couple of years, we've been working with local high school, the one across the street from Case, to engage students in an event called Science Palooza, which is a reverse science fair. We, the scientists, put on exhibits, and the high school students are the judges. So we aim to engage the kids by showing how cool and approachable science can be, showing them what a scientist can look like, that they too can be scientists, and instilling how important it is for scientists to be able to communicate their work with the public. And all of this is within the context that everyone has a right to science and to learn about science.
Thank you so much. So Carolyn, how has your understanding of service evolved during your time at Case?
So as scientists, but also as students of Case Western, we have specific skills and abilities that we can contribute to better serve society. We can be part of the puzzle that needs a scientist to solve complex problems in the community. That's why last year we traveled to Columbus to visit the Ohio State House, and we met with legislators to advocate for scientific and evidence-based policies. State policies can directly improve our community, and using data to determine the best way to solve a problem is vital to ensuring these policies can help. As Case Western students, we really believe it's important to advocate for our neighbors and our community.
Thank you, Carolyn, for that very thoughtful response. Dr. Ranjendram and I would like to thank all of you for your service to others. So in addition to learning, discovery, and healing at Case, our students participate in authentic community engagement through their service to others.
And healing. As future healthcare providers, our ultimate goal is to heal. We are sitting in the midst of the chaotic events of 2020, and together, arm in arm, we seek to focus on the positive, what is working well, and where we can address the problems in our part of the world here in Cleveland. We have many problems, big and small, and we want to do our part to make progress, including on the planet. Dr. Nadowitz will now have a discussion about one project with our students.
Thank you, Professor Logio. There are different levels by which we in the medical professions can actualize our desire to bring about healing. At the level of individuals, at the level of communities, and at a still more global level, the level of the planet. Here at the Cleveland Clinic Lerner College of Medicine, I've had the opportunity to work alongside several wonderful medical students, Kate Lowe, James Sullivan, and Nikki Winchester, on an ongoing major effort called Achieving the Possible, Projects to Repair the Planet. Nikki, could you describe the goals of this project?
Thank you, Mara. And so our goal with this project has really been to build momentum behind local efforts to address the issues affecting the health of our communities. So I think that during these times more than ever, the challenges we face with climate change and healthcare can feel daunting. But what we're highlighting through this project is the impact that local efforts are already having to address these issues. Or as the name implies, people that are already achieving the possible here in our Cleveland community. So prior to the pandemic quarantines, we had the honor and opportunity to host Dan Brown from the Rust Belt Riders Composting Group, Narcisse Fayez from the Food Recovery Network, and Suyan Scott, the Registrar of Case Western Reserve School of Medicine, and our current sustainability champion for the HAP. The three of them joined us for a powerful seminar discussing how to reduce food and plastic waste here in Cleveland and our own medical school, and the impact that we can have when we work together to approach problems from multiple perspectives. We're also excited to continue working with Dr. Aparna Bowl, Dr. Alyssa Gordon, and John Utuck. We're all doing some amazing work to reduce waste at both the University Hospital and the Cleveland Clinic, as well as some of the community gardens, specifically Summer Sprout. So I think if you're interested in the amazing work these groups are doing, please feel free to reach out to any of us by email. And if your home's not here in Cleveland, please engage with these kinds of efforts in your community, because we assure you they're there and they will be the most impactful ways to help your neighborhood.
Thanks, Nikki, for explaining the goals of the project. And James, could you start us off on a discussion of our process of formulating the goals, how we've worked together, and how this relates to the learning objectives of our school?
Absolutely. Thank you, Marvin. So all three of us had very different backgrounds prior to coming to our medical school, the Cleveland Clinic Lerner College of Medicine of Case Western Reserve University, and that has impacted our group process substantially. So I personally have a background in chemistry and environmental studies, and my interest in the environment was initially stimulated because I grew up next to a Superfund site that caused outbreaks of childhood leukemia in Massachusetts. And so our varied backgrounds allow us to not only bring different opinions, but also different skills and knowledge sets to the table when planning these events and thinking of what these events should be. Climate change and environmental health are fields that lend themselves particularly well to these diverse skill sets because they, by their nature, are multidisciplinary. And thus, as a small group, we are able to lean on our own individual strengths and learn from one another while planning these events. And this really gets to the absolute core of our school, which prides itself on multidisciplinary small group collaboration. Everyone has something to contribute, and every team is more than the sum of its parts. Nikki, why don't you tell us your perspective?
Thank you, James. So, like James, I also grew up in Massachusetts, but slightly different part of the state, and of course, a slightly different background. So I personally grew up in a family that's big on hunting and fishing. And so while this wasn't for me, it made me really think about the impact that we have on our environment and also the impact it has on us in return. So my educational background is in biology and psychology, and I previously worked in a community garden in DC, running some hands-on, more educational activities with children. So my interest in this project has really been about engaging people with their environment, as well as the nutritious foods and kind of healthy activities that can come from it. And also about trying to have practical approaches to incorporating sustainability into our daily lives. I think that it's because of our different backgrounds that we're able to also bring in such a diverse group of seminar speakers who are also using their varied perspectives to address global issues in a multifactorial approach. But I'd love to hear what you have to think, Kate.
Thanks, Nikki. So I'm actually a Colorado girl, and the mountains have always been my inspiration. I learned how to be self-sufficient, as well as work in a small team to accomplish my goals, whether it's climbing a peak or nowadays working to solve a clinical case. My background is in geology and epidemiology, and I have a strong interest in the impact of the Earth on population health. Like it or not, the Earth dramatically impacts our health. So my background in earth science has been very relevant, we've worked to develop both our climate health curriculum and this Achieving the Possible project. In our small group, one of us will often originate an idea for a future talk or learning objective that we want to implement. For example, when I come up with an idea to add a wildfire exposure to a problem-based learning case, Nikki and James will help me refine that idea. We will all work as a team to complete the background research and then write or edit the case, usually collaborating over Google Docs until we're all happy with the outcome.
Thanks, the three of you, for this full description of the process that we've used in working together. Perhaps you, James, could begin a discussion of the directions that you and your medical student colleagues hope to see this project develop in its next stages.
Thanks, Marvin. So I think, we all have tremendous dreams and really want to take this project in so many different directions, and we're excited to see where it goes. But every step of the way, I think our primary goal is to motivate and share our passion for climate and environmental health with students with this hyper-local lens that Nikki described so wonderfully earlier. And so this drives a broader, more holistic approach to patient health when we as medical students get to see what is happening in our community and what our community is doing to help and improve the health of those around us. And so further engaging with the local community allows us to understand the lives of our patients and really understand what exactly a social determinant of health might be and how we can address it both through our actions in clinic as well as our actions as members of this community. And including climate change in this effort is essential. Kate, why don't you tell us some of the more specific ideas that we've had?
So there's many future directions I could see taking. We're planning on organizing some lunchtime talks in the future on the impact of the healthcare industry on the environment, from the impact of medical waste and medication disposal to the release of greenhouse gases from anesthesia during surgery. We're also planning sessions on how historic racism influences the impact and degree of climate exposures on health.
It's really beautiful and it's inspiring. And could each of the three of you now speak to how this project relates to your futures as medical practitioners? Maybe James?
Thanks, Marvin. So I think, like so much of what we do in medical school, we are both trying to have a meaningful experience now and trying also to learn and try to figure out what direction we want to take our careers. And so I came to medical school because I'm interested in being a clinician and treating patients. And I think that it's projects like these and learning how to engage in the local community and understanding that really help you be a better clinician. I think that is one of the primary goals, and that is something that I'm getting out of this every step of the way. And additionally, I care a lot about medical education, and I really hope to have a career focused, at least in part, on medical education as well. And so crafting these sessions, trying to bring in seminar speakers and thinking about learning objectives and working with colleagues to create a meaningful experience for those who are going to participate in our educational activity is really wonderful and has been eye-opening, and I've learned so much. And then lastly, again, the intersection of policy as well as what local communities are doing to address huge global problems within your backyard has also showed me how I might be able to then future affect policy and population health by, again, engaging with this local community. Nikki, what about you?
Thank you, James. So I think what I found most exciting with this project is just seeing the impact that knowledge can have in improving the health of our communities. So as James, I think you really nicely highlighted how big of a role education can play in these efforts that we're involved with. And I think many of the incredible organizations and people that we've been working with are using their knowledge of environmental issues to inform their communities and then to work together to take action on this information. And this is really how I see my future role and all of our future roles as physicians. So our job is to share with patients the knowledge that we're trying so hard to gain during medical school and our medical training, and then work together with them to find solutions that are going to work with them. And so I think that in healthcare, we're not only trying to understand what's causing our patients' symptoms as they're sitting in the exam room before us, but also to understand what brought them here to that point, and also to understand what challenges they're going to face when they leave, and knowing how they're going to be able to respond to the solutions we came up with within the context of their environment. So I think that by addressing environmental issues and health inequities in our communities, that is essential to caring for our patients' needs. Now, I'd love to hear from you, Kate, your thoughts on this question.
Nikki and James, you make fantastic points that I 100% agree with. Personally, I don't believe that we live in an isolated society. Everything we do impacts another person, and nowadays that person may be on the opposite side of the world. As a medical practitioner, I want to work globally and influence policy worldwide to make the world a healthier place to live, no matter where you're born. Many of the topics we've discussed or plan to discuss impact people everywhere. Looking beyond clinical medicine to the context of the world will help me become a more compassionate physician who is better equipped to tackle my patients' needs. This project is incredibly important to me because it empowers me and my classmates to work to repair our planet.
Thanks, Kate, Nikki, and James for the innovative and important work that you're doing. And thank you, viewers, for listening and watching. If you're interested in learning more about the work or in joining arms with us, as Nikki said earlier, please contact us. Thanks again.
In conclusion, this is healthcare and healthcare of the future. People learning together, discovering new knowledge, serving individuals and communities, and healing the woes of society. Healers don't sit on the sidelines. We educate others, working to translate the science of our new discoveries, and using that new knowledge to advocate for what is right and good and valuable for a long and healthy life. Together, we are at our best. Together, we can learn, serve, discover, and heal. Arm in arm, we can promote the change we all seek for a better healthcare tomorrow. Thank you.